of my 40 years of study of the published literature, as well as 30 years worth of patient contact as a colorectal surgeon. I'm not here to diagnose or treat anyone. I'm here for educational purposes only because no manner of brains is worth a good set of bells. Hey, it's Dr. Toker, your friendly neighborhood colorectal surgeon, and I am on a mission to educate the world in terms of gut health and the microbiome and how that impacts your daily life. I certainly hope you will join me on this journey, but you're going to have to buckle up, Buttercup. We're talking gut stuff. Good morning, everyone. We are talking gut stuff, and we're doing abbreviated lectures this month in light of my chaotic schedule. But I hope we still learn something. So what we're going to do is take some of the more discussed events that we've done in the past, and we are going to expand upon those sort of I shouldn't say expand upon. We're going to contract upon, do like Cliff Note versions. I'm going to do my best anyway. I'm kind of talkative. We're going to talk about collagen, the importance of collagen, that is for gut health. It also happens to be for beauty. And as it turns out, this lecture, like all of our Thursday morning lectures, is sponsored by a company called Super Patch, which uses vibrotactile technology. And we talked about that last week, which is sort of like a glorified acupuncture, acupressure to communicate with your brain to allow for improvements in certain homeostatic pathways. And one of those pathways happens to be increased blood flow and a more normalization of collagen deposition in places where collagen is lacking. And as we age, collagen is lacking in our skin and in our blood vessels and our digestive tract. So as you age, one of the things that happens is that you deposit less collagen. And the consequences of that are that you age. So any endothelium, epithelium will contain collagen. Your bones, your ligaments contain collagen. If you want to have longevity and better life, you need to sort of focus on your collagen. And it's not just about taking a collagen supplement, it's about doing a variety of things. And I am going to try to be as brief as humanly possible. You know me, I like to talk. So I'm going to be as brief as humanly possible so we can have a little mini lecture. So what is the aging process? The aging process, as I mentioned, is a decrease in both collagen and elastin, but by virtue of that, you also have a decrease in tissue hydration. There's a substance called hyaluronic acid that's sort of missing. We also have a tendency over time to lose muscle mass. We tend to have structural loss of bone, muscle, and fat. We also tend to have an increase in oxidative stress that just has been accumulating over many, many years. And as we get older, our body has a harder time managing blood sugar levels, and blood sugar levels rapidly increase the rate of which we age, and why that's important. Now, gut dysfunction parallels your age. So when you look in a mirror and you see, like I do, I'm missing some cheekbones. I'm older. I don't wear a lot of makeup, as you can tell. And so I can see the wrinkles, and my cheekbones are getting a little low. But that means the same thing is happening everywhere. It's in my blood supply, in my joints, in my bones, and in my intestinal tract. So if you are aging, and I hope that you are, these things are happening. You might find as you age, you get gut dysfunction as a result, and all the same factors are involved, especially if you're having problems with oxidative stress or if you're having problems with blood sugar levels. All of those things are damaging to the gut, and the more damage the gut gets, the worse you have control over oxidative stress and blood sugar levels. Now, the lining of your body is an epithelium. Epi just sort of means around. It's like it's the thing that wraps you. You're like, you the wrapper on a banana. That's an epithelium, and it's made of what we call squamous cells. Like all linings, whether they're epithelium or endothelium, there's going to be a basement membrane. That basement membrane is sitting on top of a collagen matrix, which has blood flow and nerves. There will be sensory organs to the skin that are very specific in skin, unlike the intestines and a lot of other places. You've got to protect yourself from the outside world. So that one thin little layer that will suffice in the intestinal tract, not good enough for the outside world. So your skin has an alive layer at the bottom close to the basement membrane, and then it's replaced and pushed up through the skin. So there's many layers. And as that little cell goes up, it gets further away from blood flow. It winds up dying. So the top layer of your skin is pretty much all dead. Certain parts of your body have really thick skin, certain parts of your body are very thin, and the amount of dead skin has a tendency to depend on what protective surface we're talking about. Your skin is, for the most part, water resistant and can get waterlogged and that sort of thing. It's not drug resistant. So there are drugs and salts and toxins, all of which can get through your skin. And so your skin is not as perfect of a protector as one would like it to be, but it has to be that way so that you can interact with your environment. Now, the endothelium is what lines, this looks like intestinal tract endothelium because it's one layer and there's a little flagella at the top and a little mucus at the top. So that's probably a small bowel. You can see in this picture, well, I think you can see in this picture, at the bottom of, let me see if my little pointer's working. This little purple line right here, that's the basement membrane. These cells down here kind of represent different cross sections of cells and blood vessels and lymphatics and nerves that are sitting in a collagen matrix. A gel-like substance is sitting down here, and that's where all the blood supply goes through. In the intestinal tract in particular, it's kind of hard to see the way it's cut through the tissue, but this little cell starts here. It's got a little outlining. It's going to go all the way down to here. It's going to be down here. There's one nucleus per cell. So the way it's cut through on this slide is kind of hard to tell for a layperson. But these cells are cram-packed next to each other. And these little junctions between the cells are supposed to remain impervious to solutions that might be within the intestinal tract right there. Now, your skin is innervated by an autonomic nervous system, both a parasympathetic and a sympathetic. This nervous system allows for sensations. It also allows for immunological responses. Your brain is using constant input from the skin. And we talked about this for the last month through something called a piezoelectric channel. Your skin is getting light signals, sound signals, vibrational, stretch and pressure senses from its environment. And each of those little sensations is turned into an electric signal, which is then sent up a nerve and to the brain. We talked last week that if you organize those little signals to the brain in a very particular way, you can communicate directly with different parts of the brain. And that's the technology deployed in SuperPatch. The GI tract is innervated, well, gosh, with very similar nerves. The cells are a little bit different, but they too can respond to sound, light, stretch, and pressure. They don't have the pokey pain, but they have stretch pain in particular. There's an autonomic nervous system, and then there's also an enteric nervous system to cover the entire length of the GI tract. And all these things sort of talk to each other through nerves that run underneath the basement membrane. What I mean to say is that your brain is actually controlling everything, not just your muscles and not just your sight or your sensations, but even things that you cannot sense, such as your GI tract or even um, fine sensations on your skin. You block all those out consciously, but your brain, your subconscious knows that those things are there. So what does this have to do with aging? As we age, because your blood flow decreases, because you have increased oxidative stress, your body is remodeling constantly. So every 7 years, your body has had an opportunity to completely replace itself. And as it's doing that, you're losing structure. This is why older people look older and then why younger people look younger. The skin gets thinner. Your complexion gets a little bit irregular because of damage and oxidative stress. You will get jowls. It's from a loss of bones. When you lose bone here, the face slides and you get a little bit of a jowl down there. And scowls are kind of how, the ends of your mouth turn down and your eyebrows have a tendency to sag a little bit. You start to look angry. Get off my lawn. That's kind of how old people do. I can do that sometimes too. I don't mean to. It's just I'm getting older. I'm like my dog. What can you do? Now, when it comes to your face, the intestinal tract doesn't really behave this way, but your face does. As you age, the shape of your face changes. And from an aesthetic standpoint, so now this is me, the med spa director, talking. Young faces are oval. They're like a little balloon. As you get into your mid 20s and your 30s, you hit one of these upside down triangles. And that's really the aesthetic gold standard, is that upside down triangle. When you get to be my age, as this lady in the bottom left-hand corner, your face kind of becomes more square-like. Get a little bit more of this down here action. That is what it is. And then when you are older, another 10 or 20 years older than me, then you get the right side up triangle where you really have lost a lot of the cheeks and it's now settled down, by your ankles. The goal of any aesthetic regimen is the wow factor. When you help somebody try to recover their appearance, you want it to be like, wow, you're looking good, not wow. Had some work done, did you? So you want wow, not wow. And so I personally believe the answer to that is to support a natural process. If you go to cultures where they do a lot of outdoor activities, they have a healthy diet, they get a lot of exercise, they don't wear a lot of makeup necessarily. There's not a lot of fast food type things. You will find that they age seemingly slower than, let's say, Americans, because we're kind of doing a lot of things wrong. It's one of the reasons why my med spa has a Scandinavian and European theme to it, because in my opinion, it makes no sense to spend thousands of dollars topically on your face and then leave my parking lot and smoke a cigarette or drink a martini. Although I do love a martini. I'm not knocking that. I'm just saying those are the behaviors that encourage aging and can undo all that you have just done in the spa. So always support the natural process, those of you who want to age slower. Now, engaging in aesthetic consultations is awesome. Just beware. This is where following pictures of what people post is important to make sure that your aesthetic, and it's almost always a nurse or a plastic surgeon, make sure that they understand the nature of natural aesthetics. If you try to turn back the clock more than 10 years, you will start looking like you're falling out of an airplane, your skin's too tight, or you'll look like an alien. You've seen those people, the big cheeks out here. What they're doing is fluffing up the cheeks to lower this jowl line, but they go too far and start looking like aliens, or they do a little too much with the lip. I mean, ladies, just so you know, I have, in all confidence, asked many men this question, and they could care less about the lip filler thing. Just so you know, not to shoot my own business in the foot. I believe my nurse practitioner does and the nurses that train under her do a fantastic job of making sure that people don't walk out of there with too much. Okay. You want, wow, you look great. Not wow. So the R's of aesthetics are to relax. You want to relax the wrinkles. In other words, Botox and those botulinum toxins will do that. You can resurface the skin. In other words, remove those old dead layers and expose some of the younger, newer layers. When you're doing that, a couple things are happening. Number one, you're letting the lower layer shine. You're getting rid of some oxidative damage that's in the upper layers, but you're also stimulating some collagen deposition when you do that. You can refill areas of laxities or deficits. So I've lost cheek. If I were to do filler, I would do it here and here, but my husband won't let me do that, so I don't. Or if you really struggle with lots of extra skin, and if I were to do a resective surgery, I think it would be my eyes, because the stress of my life has aged my eyes horribly. Things that you should do for your skin, for your health, are number one, replenish the nutrients, hydrate, get your rest, stay away from the sun if you can. The one place you should be putting sunscreen is on your face. I don't know that full body sunscreen is more helpful than damaging unless you're spending hours in the sun. So I tell people spend 20 minutes a day in the sunlight without sunscreen, but you can put it on your face. Just make sure you have skin exposed. I say that so people can get their vitamin D conversion in their skin. You should refuse smoking, sugar, and alcohol. And I've never touched a cigarette, but I truly am addicted to sugar. And if Steve is making me martinis, it's very hard to resist a martini when your husband is giving you one. So, truth be told, I don't follow sometimes my own advice. Hydrate. When you hydrate, it brings a youthful appearance to your skin. And that hydration stays in the skin through something called hyaluronic acid. And hyaluronic acid is something that you can take as a supplement. It is present in animal foods, especially bone broth, collagen-containing foods, but you can get it in the vegetarian, vegan world through sweet potatoes. The collagen layer and hydration in particular is going to help you absorb nutrients in the intestinal tract. Although I will give you a caveat, there are some diseases where too much collagen is deposited in the intestinal tract, and then all of a sudden it's not helping you, it's hurting you. That is an uncommon event, but when it happens in older women who are postmenopausal. And I shouldn't say older women because I'm in this age category, but anyone who's postmenopausal woman is at risk for that particular phenomenon. I personally believe that is a hormone issue as opposed to a collagen consumption issue. These are not people who are typically taking a lot of collagen. That's not why it happens. I think it happens as a result of stress, aging process, and most likely hormone and microbiome deficiency, if I had to make a guess. Hydration also increases blood flow. It improves your detox. I'm showing lemon water, which is really good for your detox, helps your blood stay alkalinized, can prevent kidney stones, and helps your liver clear things. Collagen, that's sort of the crux of this conversation. You will make your own collagen by consuming all 20 amino acids. Collagen is a proline-rich protein. If you're getting a good protein mix in your life, you may not need a collagen supplement per se, but collagen requires vitamin C to be made in your body, and collagen requires hyaluronic acid. So it's more than just eating protein. You have to make sure you're getting those other things. But everything in your body, not just your face, requires collagen. It's good for your joints, it's good for your muscles, it's good for your skin, it's good for your GI tract, it's good for your eyeballs, it's good for all kinds of stuff. We want to avoid oxidation, and in the modern world, that's like sunlight, but it's also cigarette smoking. It's sugar. I have got to stop eating sugar. Y'all help me. I'll go months without it, and then someone will hand me a piece of chocolate. Why? Why do you do that to me? I'm weak. Can't help it. You may be like me. Who knows? Toxins in our environment, toxins in our food. Seed oils. This is a big and bad one. Canola oil, sunflower oil, safflower oil, vegetable oils in general tend to have a lot of omega-6 fatty acids, which help feed into the inflammatory pathways of the body, as opposed to omega-3 fatty acids, which are the anti-inflammatory pathway. So you should be eating fish oils. You should be cooking with olive oil, avocado oil, coconut oil. Those are better forms of oil because it has a better balance of omega-3 to omega-6. Now, the microbiome. Hey, it's my jam. It's shocking. Everything about you revolves around this. It's not just poo. It is not just poo. The bacteria in there are critical for your well-being, including your ability to absorb things such as collagen and your amino acids and your vitamin C and your hyaluronic acid. So the microbiome helps reduce oxidative stress, reduce inflammation. It helps you absorb all of those nutrients. And as a result, it will help improve your skin texture. My patients who come in with bad skin, it's thin, it's dry looking, it's almost gray looking. There's no brightness to their skin. Those people, I can almost guarantee, have a gut problem. The two go together. If you've ever had stomach issues, you might notice your face breaks out and all kinds of stuff like that. So what's happening to your face is definitely happening to your GI tract. A healthy gut will help you resist infection and will help you promote healing otherwise. And so the microbiome is critical. Sleep is critical because that's the time that you repair injuries. It's also the time where your fluid in your body sort of redistributes evenly throughout your body. Your body has a better time controlling blood sugar, although if you're me, that is not true. The only time I have high blood sugar is at night when I'm sleeping. Stress, I riddle me that, Batman, all night long. The second I close my eyes, my blood sugar goes up. It is the weirdest thing that I found out about myself using a blood sugar monitor. Assuming it's cortisol related, one has to assume. Your body's supposed to normalize its cortisol overnight and then with a little spike early in the morning. And doing all of those things helps you reduce stress, and reducing stress reduces cortisol. Now, I always suggest gluten-free if you've never watched or listened to something I've talked about. Just know I'm a gluten-free kind of a person. I think that's critical. Gluten is inflammatory to your body. It increases the permeability to toxins, or what we call leaky gut. It allows you to have bacterial overgrowth. You get mesenteric inflammation. There's a molecule called zonulin that's responsible for that effect. It helps, or rather, it hinders your ability to control your own blood sugar. So if you are a diabetic, you should be gluten-free. And if you're struggling with your health in any way, shape, or form, you should be gluten-free. You should say no to sugar and alcohol. Anna, listen to what you're talking about here. Liver health is critical. Your skin, you can see somebody with liver disease. They show it in their skin. Autoimmune diseases, obesity, metabolic disease, dementia, all of those things start first with a blood sugar issue. There is something called a glycation end product these glycation end products are very stiff. So they stiffen your joints and your skin, and the proteins in your body so that they don't function properly. Seed oil, we talked about that. At that they are inflammatory. And this is the danger with going out to dinner, and it's the danger with buying processed food, is that they're all socked full of seed oil. Fun fact, the modern American is consuming an extra 300 calories per day in seed oils alone. That's a lot of fat because it's everywhere. Now, you can train your microbiome to behave for you, and you do that by eating lots of a variety of raw fruits and veggies. And if you can't chew them well or you don't digest them well, then get them as a smoothie, get them as fresh as humanly possible. You need your protein, you do. That's how you make collagen. Um, you need to be hydrated. You need your vitamin C. You need hyaluronic acid. And of course, you need to stay active because all of those things help your body regenerate yourself. Now, the supplements, and y'all can get this slide from our website because I'm going to say this real quick. We've talked about protein. You can do a collagen supplement or you can do a really good protein supplement. If you do a collagen supplement, make sure it has both hyaluronic acid and vitamin C in it. If you do protein, you're going to have to take the hyaluronic acid and vitamin C as separate entities. But if you eat a good enough whole food diet, you ought to be getting these things in your diet anyway. Vitamin E is a fatty acid vitamin. Vitamin D is as well. Zinc, selenium, N-acetylcysteine, and omega-3 fatty acids. All of these things are critical for anti-inflammatory purposes and also to improve hydration, collagen deposition, skin health, and therefore gut health, or gut health and therefore skin health. Mitigating stress. Everything in life starts with mitigating stress because cortisol will kill you. Now, this lecture, like all others, is sponsored by Super Patch, and they do have one that I swear by that definitely helps with stress levels. So as my blood sugar is spiking at night, if I put on both a peace patch and a REM sleep patch, it can decrease my overnight blood sugar by 10 points on average. Now, that is just me. I don't know about you, but I'm just saying this is what made me think that it is my stress levels that are leading to my blood sugar problem. That's all cortisol related. If you have pain, they have a freedom patch. They do have a patch out called Lumi, and this is what I wanted to talk about. The publication is, the data is in. It's being thrown together into a publication on the daily use of this patch. At first, it was one of those, you put it on, and you really can see sort of a glow in your skin, and you take pictures and everything looks nice. And so people who do a lot of selfies and go out, and a lot of young people are doing the Lumi patch. Well, as it turns out, people like me, in fact, I just ordered some, people like me are getting older who want more collagen in their life, and they want to try to do it as naturally as possible. This is not a bad option. Their study, and I don't want to make a claim that's not published yet, but is starting to demonstrate an improvement in collagen deposition in the skin in the subject of this trial, the subjects of this trial. And most of our trials are placebo controlled, but I don't know about this one. So that's why I don't know what to say just quite yet on that until that is published. But it's exciting to know. And I personally have put in my order for my Lumi. I'm going to start wearing those. So over the course of the next couple months, we'll see if there'll be a difference. Is there room on my body for another patch? Is really the question one has to ask oneself. If it's happening on your skin, is it happening in your GI tract? Now, that's a study we have not done yet. And I did talk, they're going to start firing up a study on the microbiome. And I've told them to investigate peace, liberty, and potentially this Lumi patch for that, because I think, it stands to reason those things would all act in unison. Oh my gosh, was I able to get through that fast enough? I hope that was still educational enough. I feel like I just blazed through that information. Anyway, that's going to be the nature of the next month. We're just going to shorten these talks to a little less personable stuff. Yeah, I still talk for 30 minutes. Oh my goodness. I can't be short talked. I don't know how to do it. Anyway, I hope you are having a good week. Consider doing things to improve your natural beauty by eating whole food, um, food sources, drink lots of water, and consider yourself a Lumi patch because I think it might help. And that is what I will be doing. So we will see you next week. And remember, all the lectures this week, I am just going to post. I won't live broadcast. And they will be on topics like this, where I'll kind of blitz through them as fast as I know how, which is still kind of long winded.